All right. Good morning, everyone. I hope you can hear us. This is Natasha Malik here from Dubai Future Accelerators. With me, I have a Dubai Health Authority team. I'm going to introduce them to you in a little while. So just to tell you a little bit more, before I go into telling you a little bit about Dubai Future Accelerators, I would like to thank you for joining us for this webinar. And today what we plan on doing is basically answering any kind talking you through what the program is, talking you through the specific challenges for Dubai Health Authority. And also in the end, we will be taking questions in the case that you may have any queries. Now, also, just to let you know that this webinar is being recorded and will be shared with startup scale-ups after this session. So there's no need to set up your own recording. We will be recording the whole webinar and sharing it with you and other companies that inquire about the challenges of Dubai Health Authority and the program. So if we go straight into it, we're going to be, I've just talked you through this. So my name is Natasha Malik. With me, I have from Dubai Health Authority, Dr. Shata Al-Ali and Dr. Khulud Al-Ali. They will be telling you a little bit more about Dubai Health Authority, as well as then talking you through the challenges as well. Now, just to let you know, Dubai Future Accelerators is an initiative of Dubai Future Foundation. And these are both initiatives of Dubai government. So all the work that we do is for the impact to Dubai. Now, the whole idea of the accelerator program actually came from this quote from His Highness Mohammed bin Rashid Al Maktoum, who is the Vice President and Prime Minister of the UAE, and he is the ruler of the Emirate of Dubai. So the quote goes, "The future belongs to those who can imagine it, design it, and execute it." Now, all the activities of the Dubai Future Foundation focus on imagining, designing, and executing. What we as Dubai Future Accelerators focus on is on the design aspect. So what we do is we understand the requirements of our different government partners. So these are different government departments in the UAE. We understand where is it that they would like to innovate their services, what kind of technologies or what kind of processes would they like to streamline. And then we look at connecting them to the right startups or scale-ups which have the right innovative solutions. And the outreach we do globally. I mean, we have worked with numerous countries already. And what we try to do is we basically want to co-create and test solutions with these government partners. So we're looking at solving the challenges that the government partners are facing. And over the course of the program, it's really about co-creating and testing a solution to solve the problems that the government partners are facing. Now, the selected applicants get invited to a 12-week in residence program in Dubai. Just to let you know, it is usually a 9-week program, but given the specific structure of the way Dubai Health Authority works, their program will be a 12-week in residence program. And we cover the travel and accommodation of up to 3 full-time team members to join us in Dubai. So what we want to do is we understand, we don't want there to be any barriers to you being able to test your technology or from us being able to gain impact from your technology. To this end, we also do not take any equity in your business. So like I mentioned in the beginning, our focus is impact to Dubai. And this is, there are no commercial advantages to us for this. So what happens during the cohort in Dubai? Now we work hand in hand with the so what you'll be doing is you'll be working very closely, if you are selected, with the government entity to clearly understand their challenge. So if their challenge is focused on specific processes, it'll be about understanding how the current processes are currently running. It is then you will be testing your solution and you will be proving that you are the right solution provider to address their challenge. You will, by the end of the cohort, have a presentation to the senior decision makers at the government entity that you choose to work with. What we also do, of course, the prime focus is for you to come in to explore business opportunities and to test your solution with the government partner. But from our side, we also ensure that in a way, this 12-week sprint for you is like business development on steroids. So we try to give you as much information about the local ecosystem. So we conduct a lot of workshops that we feel would be relevant to you about, let's say, local business culture, given that you would be looking at conducting business meetings locally. Also, if you were looking at setting up in an office in UAE, how to work with the local media, branding. We've also done other more specific tailored workshops depending on the government entity that you're working with. Then we also support you with business development. So I don't want to get into too much detail about this, but DFF also has Area 2071, which is focused on corporates, the private sector, as well as startups, as well as government. So what we can do is give you access to our ecosystem. Beyond that as well, we are able to make introductions in Dubai. You will also realize that it opens up a lot of doors for you, especially if you are an participant or an alumni of the Dubai Future Accelerators program. We also have a lot of community events. That's something that Area 2071 does quite frequently. And then we also can make investor introductions if it is a good fit. So over the course of the 12 weeks, when you move to Dubai, where are you going to be based? So our co-working space is located in the Emirates Towers. I don't know how many of you have been to Dubai before, but this is one of the iconic buildings in the DFC area. And we are on the ground and the first floor of the boulevard. Now, I wanted to tell you a little bit more about Area 2071. So like I mentioned, we also have some corporate partners. Some of these include the likes of Emirates, Microsoft, Vico, EY. If you are selected or if you get a chance to come into the space, you will see that we have a lot of, let's say, X labs and innovation spaces here on the ground floor and the first floor. This all harbors into the ecosystem, which is Area 2071, which is to kind of innovate together and bring impact to Dubai. Now, I'm going to hand over to our colleagues from Dubai Health Authority, Dr. Shata and Dr. Khulud. What they'll do is talk you through a little bit about Dubai Health Authority and then also introduce their challenges. I also want to request that we hold all of our questions till the very end, and they would be more than happy to answer whatever questions you may have. All right.
Hi, good morning, everyone. This is Khulud Al-Ali from Dubai Health Authority, and I'm here today with my colleague, Dr. Shada Al-Ali. You can hear me, right?
Yeah. Hello, good morning.
So if I'll just give you a brief snapshot about Dubai Health Authority. Dubai Health Authority is a health providing sector in Dubai. We have 4 different government hospitals in Dubai. Each one specializes in different area. One of them, Latifa Hospital, which is a maternity-related hospital and a children hospital. Then we have the trauma hospital, which is Rashid Hospital. We have another hospital as well called Dubai Hospital, which has different specializations that it focuses on beside the trauma. And then the last hospital is a general hospital, which is called Hatta Hospital. We have around 12 primary healthcare sectors in Dubai, and our organization has around 12,000 employees. You want to add anything, Shada?
I think that's basically it.
So we have been with DFA for around 6 cohorts, and now we are working with them on the 7th cohort, and we wish that we find companies that can help us to solve the challenges that we are facing. I'll give you a brief about the first challenge that we have. for this cycle, which is improving the quality of life by early and swift healthcare intervention using advanced technologies in healthcare. As you know, there are many diseases, there are many sicknesses which many people are suffering from. What we want is early detection of the disease. Any technologies that can help us detect the disease early without the need to wait for the disease to be at a later stage and detected. And as well, we want technologies that can make the detection simpler for the patient, non-invasive sometimes, because many patients, they have to go through blood tests, they have to go through radiology to get the detection done. However, if we can find a new advanced technology that can lessen the use of these procedures, this will be of a great help for DHA, for the patients as well for DHA, and it will reduce lots of costs. The second challenge that we have is about reducing patients' waiting time in emergency cases by using, again, advanced and cutting-edge technologies. As you all know, emergency rooms are always packed with people. We have many patients waiting for a long time. So we want to get some technologies that can help us assist all these patients who are waiting, so that we don't lose patients. Because we have, let's say, 10 emergency rooms available in one time. But if we have advanced technology that can help us assist these patients while they are waiting, this will be of a great help for DHA.
The third challenge is patient safety during surgeries. And that's to improve the accuracy and patient safety in the surgery, such as spinal surgeries, for example, which can be very, accurate procedures. And examples of ways that you can that we can achieve this is by using innovative technologies. So, as you know, these procedures are very accurate and delicate, and they can have many risk factors. And if you have a technology that can decrease these risk factors or decrease the complications of the procedure, and this can, of course, save the patient's lives. As for the fourth challenge, it's to use VR gaming, use VR gaming in extracting images of the retina. So we want to improve the quality of life by swift healthcare intervention using advanced technologies in AI and healthcare retina disease detection through VR, virtual reality. So if there's a gaming company or a gaming application or some kind of technology or innovation that can participate to this, this is something that we're looking for. And we want to be, one of the first, this is one of the areas that we want to focus on for this cycle.
We don't want the regular retina scanning that you scan and then put the images on the system and then it gives you what diseases it has. No, we want a different kind of retina imaging, detection of diseases through the use of VR.
Right. Okay, great. I think that was a good brief on all of the challenges. I also know that you predominantly focus on more tangible technologies.
Yes,
yeah.
Tangible technologies. We don't want systems at this moment, no platforms at this moment. We want hardware, tangible technologies, as you mentioned. But I know that some tangible technologies come with a software. We don't have a prohibition for that if it is linked with a tangible device. And we want, in terms of devices, they have to be CE approved or it has FDA approval. And the device should have been tried or on a good number of patients, around like say 100 patients, in order for us to try it on.
Perfect. All right, I know there must be a lot of questions. So what we'll do is we'll also open up for questions right after we talk about the selection process. So now that you know about the program, you know about the challenges, especially for the ones focused on Dubai Health Authority, we're just going to talk to you about how the selection process will work. So the first stage, you will apply on our challenge platform and you will submit your written application. The written application is going to be reviewed and you will then move on to the second stage if you pass a certain threshold score or not. The second stage is going to be a phone interview. This is going to be a phone interview with Dubai Future Accelerators team, just to verify your information and to understand a little bit more about the solution that you are proposing. Once you pass through the second stage, so it's either a yes or a no at that stage. If it's a no, you will receive a rejection email. If it's a yes, we will then shortlist you as your company and then pass it on to the DHA team to evaluate. From their side, I think they will hold technical interviews if they see fit. They will review the applications, they will review our comments, and then make a decision on which are the companies they would like to invite to Dubai for their program. So once they have decided on the companies, we go through the onboarding process. So the selected companies will be notified by Dubai Future Accelerators. We will then organize your flight, visa, and accommodation for up to 3 full-time team members. Just to clarify, we only provide 1 return flight per team member. And then we, prior to your arrival, we have another webinar that is to clarify any kind of questions you may have. We also talk you through a little bit about the program calendar and how to prepare for your time in Dubai. 12 weeks, in fact, is quite a long time. All right, so application deadline is November 17th. That's 11:59 GMT plus 4 local time. And if you have any questions, you can reach us at cohort@dubaifutureaccelerators.com. If you would like to apply, that is at www.dubaifutureaccelerators.com. You click on the apply now, you can see all the challenges. The apply now button will take you to our challenge platform where you can apply for DHAs and any other entities challenges you see fit for your technology. Now, I think this is the moment everyone's been waiting for, questions. So the way we're going to run this is either you can raise your hand or you can type your question out and we will address it. So let me just see what we have. All right, we already have a few questions. All right, so I'm going to, all right, just bear with me, please. All right, so. Okay, Shashanka, I'm going to unmute you now and you can then ask your questions. All right, unmuting. Wait. Sorry. Where's my mouse? Sorry, guys. Having a little bit of a technical difficulty. All right. Shashanka.
Good afternoon.
Yes.
Good afternoon. Can you guys hear me?
Yes, we can hear you.
Thank you so much. That was a pleasant introduction. My name is Shashanka. I have a question on early detection. Is there any specific disease condition are you guys looking? Because we are primarily focused on neurodegeneration, early detection, and also improving quality of life. So I was trying to see where the match is. So I was wondering.
We are not focusing on any specific disease. So we are open to different diseases.
Okay, and I have a follow-up question as well. When you say FDA approved, especially if you are looking at the spinal side of the equation, are you guys looking any kind of clinical trials that needs to be done before you consider, or how exactly
any
you address it?
device that has an FDA or CE approval, definitely it should have been tried on significant number of patients. We will not make any trial on a brand new device that was not tried before.
Okay, great. Thank you.
Thank you. Thank you, Shashanka. I will now unmute. All right, we have Bhaskar. I think you have a question. I will now unmute you. Go ahead.
Hello, it's me Bhaskar from Nepal.
All
Is
right.
there any IP protection for idea or products in this accelerator program?
So could you repeat your question?
Is there any intellectual property protection in this program or
Intellectual
Property. So within the healthcare space or otherwise?
healthcare space?
All right. Well, what happens is that, okay, do you have, okay, when you say intellectual property, is that on the lines of the work that you will be doing during the course of the program
Yeah,
with your technology?
yeah.
All right. Well, that would then be discussed directly on a case-by-case basis once you have been selected for the program.
Okay, thanks.
Thank you. All right. Do we have any more questions? All right, Shabazz, I think you have a question. I'm going to unmute you so you can ask your questions. Go ahead.
Hey, am I audible?
Okay, wait, sorry. Yes, go ahead, Shabazz.
Can you hear me?
Yes, we can.
Yeah, so this is regarding the challenge number 2. So we just wanted to understand where is the maximum amount of time consumed, and if you can just give us a quick walkthrough of what happens in an emergency and where are the bottlenecks that needs to be addressed.
It doesn't have to be a specific time limit. It's not like a race. It's just anything that can contribute to lessen the amount of the waiting time, I mean, for patients. For example, one of the cohorts, we hosted a company that had an emergency platform in which you can direct the ambulance to go to a specific hospital that most suits this type of patient, the needs of this patient in the ambulance. Or it can tell you the amount of beds or resources in a certain location. So you target this certain location for this specific case. So it can be anything innovative that contributes to lessen the waiting time. It doesn't have to be just a specific, target.
All right. I hope that answers your question, Shabazz.
Yeah.
All right, perfect. I'm now going to move on to Dennis. I think, Dennis, you have a question. Wait, just give me a second while I unmute you. Go ahead, Dennis.
Hi, thank you for this opportunity. I have three to be exactly. First one is the early intervention challenge 1. Is that intervention only targeted to?
Okay, Dennis, we lost you. Okay, Dennis, if you could just type out your question because we seem to have lost you.
I'm here.
All right, okay, if you could, yes, if
okay,
you could.
Again.
Yeah, I
challenge
think
1.
Yes.
Early intervention. Does that also mean that you have prevention targeted?
It can be prevention as well.
So is it also for the overall population or only targeted towards hospitals?
No, it can be for overall population as well.
And the last question is the FDA that you need to approve. Is it only FDA or also that they're here CE?
There's either FDA or CE.
Okay, thank you.
All right, thank you, Dennis. All right, let's see who else has a question. All right, Nishant, you've raised your hand. I will unmute you. You can ask your question. Go ahead.
Yeah, hi Natasha. So thank you for the session. Just a couple of queries from my side. Is dental also covered under the DHA, dental department?
Yes, we have dental.
Okay, so we already have a request or a challenge which was mentioned by the department. So we already have built some prototypes for that to solve. But can we take those kind of solutions also through this platform?
From which department?
From the dental department, DHA.
So you are from DFA?
No, I'm not from DHA. We are a startup company, and we during our last visit for the Arab Health, we had discussed this challenge with them, and we are working with them. But then,
solution? You have already
pardon me?
a solution with them?
Yeah, we have just started discussion. So the prototyping and all, we are working on it. So is it possible that we can work through this platform?
Yes, I think you can go ahead, apply. It's just keep in mind, because the requirements of these specific challenges is towards having FDA approval and CE approval. Yeah, and even if it's on the way, that's fine, as long as you have applied for it. So I mean, it's just keep that in mind. You can still go ahead and apply. We will evaluate your application, and I mean, we can see if it works for you this time.
Yeah, but because this one is actually for the being Dubai as the #1 in oral care. So we have some solutions for that, and we are doing some.
Okay, great. Thank you so much, Nishant. I look forward to your application.
Sure, thanks.
All right, I'm now going to move on to Yasser. I think you have a question. I will unmute you now. Go ahead, Yasser. All right.
Yes, hello, do you hear me?
Yes, we can hear you.
Thank you for having us here. Thank you for organizing this.
Of course.
I have three questions. First one, is this overlapped with, this cohort with Dubai Future Accelerating? Is it overlapped with WAMDA, or it has its own program?
All right, just to answer that question, the Dubai Future Accelerators program is an independent program, part of Dubai Future Foundation. Yes, WAMDA is one of our partners as part of Area 2071, but this is an independent accelerator program. WAMDA, I think, has a different one.
All right, but that will not make any troubles applying for booth, no?
I do not think it will have any, I don't think it will have any negative impact, no.
All right. This is one question. My other questions are, is it acceptable to have Saudi FDA approved, not the American one?
It depends what is the technology that you are proposing.
It's like, it's something for prevention. I think I will apply for today, but we also have, that will lead me to the third question. If we can move on, if our platform can solve different challenges, let's say, do we need to apply separately or mention that somehow?
So what you have is a platform, right?
Yes.
Because currently we are not looking as on a platform. As Natasha mentioned earlier, we are looking mainly at tangible devices.
All right.
Yeah, but Yasser, to answer your question in a more generic way, you are able to apply separately for multiple challenges. You do need to fill out separate application forms, because an application form is very specific to each challenge. So it asks you very specifically how you will solve that particular challenge. So so for each challenge you would like to apply for, you will have to fill out a new application form, only because the application forms are very specific.
Okay, then just a question come up, if you don't mind. For prevention, is the genomics technology is involved, like preventing some diseases by genetic and genomic testing? Is that acceptable for now?
Are you?
Depends on the technology, but we're not specifically looking for anything genetic at this moment.
But that is for prevention, like we can prevent some diseases based on genetic testing, and we have like a platform for that. It's not FDA approved from the state, but it's kind of, we submitted the Saudi FDA application.
Oh yeah, I understand, but we're not looking for anything involved in genetics, and not looking for platforms either. So
All right.
we might try to avoid those. I'm just letting you know honestly.
All right. Thank you very much. Thanks.
Thank you. All right. Does anyone else have a question? All right. So we have some written question. One of them, this one is from Natalie. Is DHA looking to license a solution or to develop own solution for which DHA will own intellectual property rights?
Our own solution?
No, I think you're more looking at integrating their solution to hospitals, right?
Yeah, it's fine. We're not looking for something to own. We can test the product and we can use the company name and everything. We just want to pilot the product and then see where it goes from there.
Yeah. Like I mentioned in the beginning, it's really just about impact to Dubai. We want to make sure that there is the best healthcare devices or the healthcare that can be provided to the citizens, residents, and the tourists coming through Dubai. So DHA will be supporting you in trying to test your solution locally and checking the impact. And then, you would still own your own solution and the intellectual property rights. Now, Dennis has asked us another question. The decreasing the overall rise of obesity in the UAE is also intervention target.
Yeah, you can consider that a disease, obesity and overweight. You can consider it as a disease, and it's one of the most prominent diseases here. So yes, we do look to target that as well.
All right. We don't have any more questions at the, okay, all right. So do we have any more questions? If you do have a question, it's your last chance to raise your hand. Okay, so Tawfiq has asked, how about our startup that uses telehealth services?
Unfortunately, we're not looking at telehealth at the moment, especially apps and platforms, because you already have an abundance of those in DHA already. And we're actually working on many projects involving that. But it still depends on the type of product, and depends, like maybe you have a tangible product that's also linked to the telehealth solution. So it depends really on the type of product. You can still apply and we can take a look at it.
All right. Any more questions? Yes, Hassan has raised his hand, so I will unmute you. Hassan, go ahead, ask your question.
Yes, hello. I was wondering whether an application is also looked at for future applications. So if probably the application at the moment is in its infancy, well, are you also looking to the future and say, well, this application could be something great, well, still interesting?
All right, I'll answer it from our perspective, then I'll hand it to Dr. Shatta. So from our perspective, the chances are it might not be able to go through the first rounds of interviews because we're very specific on the criteria that have been given to us by Dr. Shatta and the team. So it's really just about, we want to make sure that if you're going to be a part of the program, that you are going to see success. We want to increase the the chances of your success if you are selected to the program. I mean, after all, you are dedicating a lot of time and energy, and we want you to be able to give back. So from my perspective, would still encourage you to apply. The thing is, if there are more challenges, we would always reach out to you first to continue applying, or maybe there is another challenge that's a good fit. What it does do is get you on our database for the communication of future challenges. However, I'm going to be honest, because we're focused on strict evaluating criteria, it is it seems unlikely that it will actually make it to DHA's desk at this stage.
Thank you.
All right, thank you. Anybody else? All right, Dennis has one more. So Dennis, I'm just going to unmute you now. Just 1 second. All right, go ahead.
Okay, are good to hear?
Yes.
Do you hear me?
Yes, we can.
Yes, okay, thank you. I have one more question, and that's, I'm hearing a lot of, we don't are seeking a platform, but we also have a platform with a tangible product. Is that also good or not?
Yes, as I mentioned earlier, you can have something tangible that's linked to an app. That's also something that we can look at.
Okay, okay, that's my question. Thank you very much for your answer.
Thank you. Anyone else? All right. Okay, perfect. So I think we've, that was a good Q&A session. Thank you for all your questions, everyone. Really appreciate them. Now, as I mentioned, the application deadline is November 17th. So those of you who are interested in applying, please visit the Dubai Future Accelerator's website and apply now. If you have any questions, feel free to reach out to us at cohort@DubaiFutureAccelerators.com. It is the same email that shared with you the link for this webinar. All right, shukran, thank you, and we look forward to seeing you in Dubai. Thank you so much for your time today. Bye, everyone.